We see parents who have had a host of different encounters with the medical field. As a parent, it's hard to navigate, and that's why we're here to help. Today, we're going to talk about what a pediatrician is, why it's important to go to one, and how to use one. First, a pediatrician is a medical doctor who specializes in the care of children. We use this by monitoring your child's growth, their developmental milestones or brain function, and their emotional well-being to make the best recommendations for your child's health. Pediatricians are trained to look for particular signs and symptoms for a host of conditions that can affect your child. Routine follow-up is especially important in the first couple of years of life so that we can assess whether or not there may be anything significantly affecting your child's brain development and come up with a treatment plan to help your child thrive. So you may ask, what is a well check and why does my child need one? Well checks are a routine part of pediatric medicine. For infants, well checks occur every 2 to 3 months and can occur every 6 months for children 2 years and older. During a well check, we monitor your child's physical growth, checking height, weight, and your child's weight versus their height, otherwise known as body mass index, and their head circumference, your child's head growth in younger children. We monitor this along with how well your child is eating and drinking to determine their optimal growth. We also discuss developmental milestones for children 0 to 6 years of age. This helps us assess your child's fine motor, gross motor, social, emotional, and verbal skills. It is for this reason that coming to your child's well child checks is extremely important. This is because we can monitor and/or refer your child to necessary services should there be a significant delay in the milestones for your child's age. Now, developmental milestones are often grouped by age. If your child is 4 months and 0 days old, but doesn't meet a majority of the milestones for that point in time, it may be okay. Pediatricians are trained to know what milestones are important and when further follow-up is needed. Our office, Ask Pediatrics, also focuses on a social-emotional component with our patients. This is because many times pediatricians only focus on the medical and not the child's mental health. It is for this reason that we may ask you if your child may not be feeling as well as they could be. A child's environment is a strong part of their lives, and we are here to help in whatever capacity that we can, should your child not shine as brightly as they usually do. In order for a well check to occur, your child has to be in good health. This means that if your child is sick or has an ailment, a sick visit will work for you. So, now what is a sick visit? A sick visit is a visit focused on an illness or an ailment or a predicament that your child has recently gone through. Sick visits tend to be shorter in duration and generally consist of the pediatrician listening to what's happened to your child, possibly ordering further tests, and possibly prescribing the necessary treatment or ordering a referral/follow-up with a specialist. Sick visits are important to also maintain your child's health and keep them healthy and happy. So what is a follow-up visit? Follow-up visits are a way to close the loop after an illness, a diagnosis, and/or a referral. After we refer your child to a specialist or treat your child for an illness, we need you to come back in to let us know how the visit went, what treatment was given, and how this treatment is working for your child. Many times parents will just ask if we received the specialist's report and question why they need to follow up with us. It is for us to see how your child is doing, whether they are taking the proper medication, whether that treatment is working for them, and to make sure that everything is resolved or is continuing on in a steady way. This visit becomes the time to voice your concerns if you don't understand what may have been explained in the specialist visit, or if the medication isn't working, or if there is anything going on with your child's supplemental services. We need to know all of that. This way, our office can help to speak with the specialist office if you need something in between specialty visits, make changes to your child's supplemental therapy plan and/or medication, and follow up if there are any further issues or concerns. So, how do you use a pediatrician? Doctor comes from the Latin word docere, meaning to teach. This is essentially how a doctor is to be used. We go through years of medical school and then training, which gives us experience to see ailments which are more serious and need immediate treatment, and those that may be less serious. In order for us to make our assessment, this requires your help as a parent or guardian. During the encounter, the nurse will ask you specific questions beforehand. This is to triage you, as in to identify the history that has recently happened to your child, the symptoms, and the signs that you have been seeing and your child has been experiencing. Some parents take offense to the questions and see this as being nosy or patronizing. The nurse is doing this to write down the history for the doctor in order for us to be able to look at the full history, your child's health record, more clearly. We will always ask you how long the symptoms have been going on to help us with a running list of the things that could be causing your child's symptoms. This list is called a differential diagnosis, and as we gather more information, causes are crossed off of this running mental list. This is why exaggerating key pieces of information does not help. For instance, saying that your child has had a headache that has lasted for 6 months isn't helpful if they've only recently had it for a day or two. Saying this can cause the doctor to run off into a rabbit hole, which will delay further effective treatment for your child. To that end, getting angry with the medical staff for asking too many questions is also counterproductive. One of the most effective ways to diagnose is from your child's history, and this can further delay their diagnosis and treatment if we don't have all of the information. Rather than coming in and telling us what you need, try giving us the information instead. Please do not Google, TikTok, Pinterest, or Facebook what you believe your child's condition to be beforehand, as this unnecessarily prolongs the visit since we have to dismantle generally false information, diagnose, and treat your child in a short amount of time. Some of my patients believe that Googling and using the internet may be better. However, the internet gives you information by looking through the web and sometimes comes up with crazy information. Like the patient that I had who talked about not drinking almond milk because of the risk of cyanide poisoning. Please don't get me started.
Bottom line, save time and just ask us for the answers.
Our lives are dedicated to this anyways. Why not use our knowledge? Please don't yell in the office. I am a physician and I show up to my appointments early, call when I'm going to be late, and am respectful to my own physician. I am also generally respectful to my peers. I am respectful to my accountant, my mechanic, my plumber. The list goes on and on. I don't barge in their office and tell them what I need and how fast I need it, sometimes even if I am in a hurry. We expect the same treatment from our families. This is a career, and if you can't trust and respect that we know what we're doing, then please find another doctor who you trust. Plain and simple. We really hope that this helps you and your family. Please feel free to subscribe to our YouTube channel, as we have a host of other educational blurbs. For more information about our practice, please go to www.askpeds.com. That's www.A as in apple, S as in Sam, K as in kite, P as in Paul, E, D as in dog, S as in Sam.com. Take care.